Hi everyone, I'm Dr. Karam, board certified facial plastic surgeon. I specialize in facial rejuvenation, which basically means I help people look as young as they feel. And today we're gonna take you through an exciting and really fun patient transformation in her journey through vertical restore, facial rejuvenation, and you're gonna see first my analysis of what was going on from her from a facial rejuvenation point of view, an aging point of view, what my plan was, and then we'll break down into the stages of her recovery, and then finally how wonderful and beautiful she looks at this point. You're going to love to see this, and for those of you who are going through a procedure with me especially, this will give you insight into what the process is like and what to expect with the recovery and everything else that goes along with it. All right, folks, without further ado, let's break it down. All right, so meet Cess. Cess is a 61-year-old patient of mine who had all the normal aging-related changes that you come to expect. She stopped looking like herself. This was her number one complaint. She's felt much younger and yet appeared much older. And as a result, there's a disconnect between those two. And if you heard me say before, she no longer looks as young as she feels. And that is troublesome. And many of you can relate to that gap that starts forming as we age, and yet we're still feeling amazing on the inside and youthful on the inside. And we want to bring those two things together. And that is ultimately what I always say is what this is all about. This is what I do, is help people feel comfortable and feel connected with their inner self by improving and rejuvenating the outside self. So this is what it's really about. So let's break down Cess in terms of the exact conditions that were going on. So as we look at her on the front view, you can see that there is an overall change in her facial shape. Now take a moment here and we're gonna quickly just zip through an old photo of her that she shared with us when this was actually taken in 1990. So you can tell by the crazy big telephones that she's holding there. But that was the younger Cess. That's the Cess that she still feels exists. And now when we look at her in her pre-operative photograph, you see that there's many changes that have happened. Number one, and primarily, is the fact that the facial shape has changed. And what happens is the entire facial fascia moves from the outer brow, the mid-face, the jawline, and the neck starts to sag. And when you see this, the face becomes more square, but also becomes more heavy centrally, right? And you can see the deepening of the nasolabial folds. You can see the heaviness and sagging along the jawline and the looseness in the neck. And all of this together is because this entire facial fascia platform is descending downward and towards the center of the face, right? That's fascial laxity or fascial descent. In other words, sagging. So that's the biggest thing. The other thing that you can see on this front view is that she has lost some volume. Where does she lose the volume? You can see that in the areas of the temple, the areas above her eyes, the areas underneath her eyes, the area around her mouth, and her lips have actually lost a little bit of the fullness. And that fullness starts to create a little bit of a tired look, but also a little bit more of a sickly look. That's what volume loss does. It gives us a less healthy look. Now, when we approach her down the center, we see her upper lids and her lower lids are, for the most part, fine. There's not a lot of laxity going on. There's no fat pads or fullness there. So I would say check, her lower eyelids are fine. Now, that's a very rare situation where when we do facial rejuvenation, especially at this age, that we don't need to do anything specifically to the eyes, but her eyes are overall very good. So when we look at the distance of her upper lip, however, you can see that the distance has gotten longer. The upper lip has elongated, and as a result of that, makes the mouth look kind of heavy and droopy, and no longer like the mouth that she used to have. And people resonate with this when they smile or they talk. It just feels a little floppy and a little bit flat. And the test for that is when you look at the mouth when it's slightly open, you can't see the top teeth anymore. And that is the sort of a telltale sign of a lip that's gotten longer. So when you look at all this, the general feeling that most people have is they want to put their fingers here and go like this. They want to lift up in this direction. And when you do that and you look at her from the three-quarter view, you can really appreciate how all of that has come down this way and why this motion of going vertically upward would restore her overall look. And that's what this is going to do. The vertical restore will bring all this up. And that is the vectors that we're we're looking at. Looking at her from the side view, again, consistently, you can see the increased length of her upper lip. You can see the laxity along her jawline, the loss of her general neck contour, etc. So these preoperative standardized views really give us insight into what's happening to her face from an aging point of view. The final area that we look at, so we look at sagging, we look at volume, and we look at skin. And her overall skin, you can tell in the preoperative photographs, are a little on the dull side. They don't have that brightness and luminosity. And that's a normal condition as we age, is that the skin loses its thickness and also begins to build some more dead layers on the upper epidermis, which is the top layer of the skin, and that does not allow the light to reflect as beautifully and as evenly, so as a result, the skin looks a little dull. So these findings are what I would say is my preoperative assessment. And with the preoperative assessment, it gives us an insight, which is what are gonna be the perioperative treatments that we're gonna pair with these preoperative findings, right? So when it comes to the laxity and this downward drift of everything, I'm gonna pair the vertical restore with that. The vertical restore is my trademark procedure, which basically is a more advanced facelift technique that uses the deep plane, but also couples the lateral brow, the mid-face jawline, and the neck all in one single procedure, and it moves everything back up into that youthful position that once existed. So a vertical repositioning of all the tissues. What makes it so powerful is the fact that it releases all the ligaments. That's the deep plane component of it. It releases all the ligaments, allows the face to move freely without tension or tightness. And that vertical vector is what gives it the naturalness. So we're gonna pair a vertical restore for addressing facial shape. We're gonna pair a fat transfer to fill in the areas of fat loss and hollows and create a smooth transition between these adjacent areas. Then we're gonna do a upper lip lift to shorten the distance of that upper lip and revitalize and create a youthful and beautiful upper lip and mouth. In addition to the volume that's being added to these other areas, we're gonna add a little bit to the lip, which will give the lip a little bit of a fuller look overall. Then we're gonna put her on the trifecta, which is my Karam MD Skin product that is a combination of 3 treatments from cleansing, vitamin C, and then an all-in-one anti-aging powerhouse treatment called Illuminate, which has everything the skin needs to revitalize and brighten it. And we're gonna keep her on this long-term because the skin is about long-term treatments, unlike the other things that I just mentioned, which can be corrected very simply in a 3-4 hour operation, and then you come out looking 15, 20 years younger. Skin is something that requires maintenance and long-term treatment. So that is the treatment plan. Now let's take a look at her recovery and finally her overall outcome. So let's take a look. It's gonna be very fun to watch her go through the stages of recovery and then see what she's gonna look like at the end.
Hi there. Today was my pre-op with Dr. K, and tomorrow is my surgery day, and I'm excited and nervous, but I'm more excited.
All right, so we're here with Cess. She's 62 years old and we're getting ready to go in the OR. So let's take a look at what we're gonna treat and the markings for that. So primary concerns are the shape of the jawline as a result of laxity coming down this way. As you can see kind of clearly that's the general vector. So what we're gonna do is we're gonna go back up into position. See how gorgeous that looks when we do that. That's one of my favorite things to do. So the whole jawline, everything comes up. We'll come up here, lift the lateral brow, put that in position. We're also gonna shorten the upper lip length a little bit, just gently bring this up, and it's gonna bring balance to the entire face. A little bit of fat is gonna go in the temples, a little bit under the eyes and above the eyes, and a little bit down in through here. It's gonna be gorgeous.
Today is my day 1 post-op. They just changed my dressing today, and thanks to Taylor, I have less pain today. Actually, yesterday was not really painful and it was just uncomfortable, but there's no sharp pain whatsoever. You know, I just have to be careful not looking down or bending, because that's the number 1 advice that was told me. So here am I, enjoying the journey. Hello there. Today is post-op day 2, and I have washed my hair. I feel a lot better. I am really swollen, but I feel good and no pain. Really no pain. Post-op day 3. Hi, this is post-op day 4. I have zero pain and I am getting there. I'm excited. Day 5 post-op. I could see a big difference. A lot of improvement. Yes, it's becoming me. I think I am healing really good. So this is day 5 post-op. Hello, so this is day 6 post-op, and the swelling has gone down a lot. There's just bruises, but I think my face is becoming slimmer. Yay, thank you, Dr. K.
So now that you've had a chance to see these really cool stages, and I'm always so grateful to our patients who share these intimate and very kind of, rough stages, but it's also important to know that you can't just blink your eye and go from pre-op to these post-operative photos and expect to look amazing right after. You gotta kind of go through something, right? You gotta go through this, and this is what going through it looks like. But it's actually not that bad. You can see within a matter of a week or two, things really start to shape up, and then after that, it goes very quick beyond that. So here's what we have. Now let's take a look at her post-operative photographs side by side. Now, here she is on the front view, and you can see that the whole facial shape has been restored. That jawline is much more V-shaped. The lack of jowls keeps her from having that squarish and heavy look in the lower half of the face. The mid-face has come up, giving her some shape to the outer parts of her cheek, but also relieves some of the pressure and the heaviness along her nasolabial folds. And the outer brow has come up in a very natural looking way, nothing that looks unusual. Volume has been added to her temples, her upper eyelids, her lower eyelids, her lips, pre-jowl regions, all of it giving a nice balanced, soft look without it looking overdone. Now keep in mind, I didn't say I put any in her cheeks, which is somewhere that I rarely ever put fat in, because when the mid-face comes up, it simply doesn't require any more volume. And the mid-face houses enough volume in itself, it just has become displaced when it came down. And the deep plane component of the vertical restore allows this to come back up and shape the cheek back up without any extra added volume. Then, as you can pay attention to the upper lip area, you can see her mouth is much more fresh and beautiful looking as that distance has been shortened. You see more red lip, the mouth looks more attractive and more youthful and more vibrant. Keep in mind also, even though she has a light amount of makeup on, she just came in for photographs and stopped by, but what we can really see is that her skin overall is much more vibrant and fresh looking as a result of the trifecta that she's been on. You can also see that in the series of photos that she's sent during her recovery and beyond, that she's just overall more luminous and bright to her skin and more even toned. And that's kind of the quality and the importance of the trifecta, and it keeps building as time goes on. So when you take all this together and you look at her three-quarter view, you can really appreciate that jawline and neck relationship, as well as the outer cheek area. Everything just looks so much more bright and beautiful. And from the profile view, same thing. We can really, really appreciate how that jawline neck relationship has been enhanced. When we zoom in here at her ear and her incisions, you can barely see anything. And that is not to say that you should expect to have a scarless outcome, but the scars do heal really well, especially when they're closed with a lot of care and there's no tension on the incision and there's good technique. Then most people do heal quite well with the incisions that are made along the temporal region and around the ears and all that, which for the most part doesn't bother too many people, and you can see why. All right, folks, so let's take a second to take a look at her video that she sent after she has recovered, and let's enjoy her now that she's almost 6 months or 7 months out from her treatment. Let's take a peek at that.
This is 6 months post-op. Thank you so much, Dr. Karam. And this is 6 months of trifecta. I love the results. I can't thank you enough, doctor.
All right, everyone. So I hope you enjoyed that patient journey. I know how helpful these are for everyone to really get into the weeds and see how people recover and what to expect at the end of all of it. Could not be more grateful to Cess for sending these photos and being a part of this and wanting to share this to help you guys. And once again, thank you so much for your kind attention. If you haven't already, make sure you hit subscribe for more content, both on skin rejuvenation as well as facial rejuvenation. And comment below if you have anything you'd like to add, any questions you'd like to share. I'll be more than happy to answer as many of them as I possibly can. If you'd like, share this with some friends and family. Let them know what it can be like when it's done well and how natural and beautiful things will look when this type of surgery is done in using good technique and good hands. All right, folks, thank you so much once again. For more videos, cruise through the channel. We got lots more journeys, a lot of great information at your disposal. Thanks again, Dr. Amir Karam.